my name is Meghan Phillipp with Community Pulse. I'm here with Kai Tao from iCAN, Illinois Contraceptive Action Now. Kai, tell me a little bit more about some of what has inspired your work to do the work that you're doing with iCAN. A lot of your background has been in clinical settings, in doctors' offices, and seeing what happens to patients trying to access contraceptive. So please tell me a little bit more about what's fueling your work and some of your experiences.
Yes, I'd love to. Thank you for having me. So iCAN, Illinois Contraceptive Access Now, is really focused on how do we make sure that all people can get their birth control of choice at no or low cost. We really work on making sure that birth control is basic health care. So it is part of your routine visit when you go see your primary care doctor. When they ask you about your depression, they ask you if you're depressed. Are they screening for your blood pressure? The same idea. We want to be sure that people are being routinely screened for their contraceptive needs and desires, all genders. So, my background, I'm a certified nurse midwife by clinical training. I've been working in the field for about 20 years, and I am always still reminded that there's a lot of people right here in Chicago who are not sure if they have options and what they are. Oftentimes, we still hear from patients who say, I wanted this type of birth control, but my doctor said I couldn't. And oftentimes it's not true. It may be a personal bias, or maybe that provider just isn't trained, so they don't talk about it. Other times there's a lot of concerns about maybe someone's age. Let's say I have a patient who says, I really wanted an IUD, but my doctor said because I wasn't married, I can't get an IUD. And so you think, how is this happening still? But the reality is there is a lot of room for improvement in the field of contraceptive care and delivery. And so one of the things that iCAN offers on our website, which has all sorts of information for both providers and patients, and our website, by the way, is iCAN for all, the letter ICAN, the number 4, all.org. That website also has a place where you can phone a friend is what we call it. Essentially what they do is they can sign up for a quick 10-minute slot to talk to someone. It's not official medical advice, but they can talk to someone that can help them navigate how to get their contraceptive care. And so weekly, I often answer these calls. I am still hearing from people who say, I had a baby, I was told to call you to get birth control. So it's sort of really just tells us that there's a lot of people who are still not sure where to go, who do they trust, and if they can afford birth control.
And I guess it's also important to understand, what age and when people should start thinking about this stuff. I mean, what are you experiencing about people that don't know that they should be asking these questions, and how do we give them that education?
Right. So as age appropriate, but of course here in the state of Illinois, anyone 12 and older can seek certain services on their own without parental or guardian consent. For young people, we always say we want you to try to involve a trusted adult in your life. It may not be your parents, but when that's not possible, they can consent and get access to certain services. And one of those includes STI testing, which is with contraceptive care as well. So they can consent on their own for those services. And we just want to be sure that people know they have this right. I think often another piece is a lot of people who may have coverage under Medicaid. Here in Illinois, we have 5 managed care organizations. All of these plans cover all options at no out-of-pocket costs. And I think there's still some belief that maybe this one is covered because my doctor only offered this one and this one wasn't. So all plans cover all birth control methods. And so if you're not getting what you want, you can go on our website, or you can talk to other providers to see where else they could be referred to.
So the message is definitely to stay curious, that iCAN is here as an advocate and a resource, that if you aren't finding some of the things that you are looking for, there are other resources, because you may have gone to the same doctor for many years, but they might not know what's available to you. So
exactly,
your message is, we want you to be curious, to be thoughtful about your autonomy in this process, and iCAN is here to help you.
Yeah.
So I think,
I think the one last thing, Megan, I would love to mention is the religious refusals. So we know that is a law where, and here in Illinois, about 1 in 3 healthcare and hospital systems are religiously affiliated and may be practicing where they do not offer contraception for pregnancy prevention. And so that means 1 in 3 people may not have access to the birth control of choice. So that's another reason why people need to know that they have choices, and they could switch doctors if they need to get their birth control. Birth control, regardless, under Medicaid, regardless of where your PCP may be, or you may hear about your primary care medical home, you can go outside of that to get contraceptive care and still have no out-of-pocket cost. So that's an important factor.
that's really great. Thank you so much for sharing. This has been Community Pulse.